As we kick off TD Awareness Week 2023, we at NAMI Berks County want to share this informational presentation on tardive dyskinesia. I am Nicole Missimer, the Outreach Coordinator at NAMI Berks County. I am sharing this presentation to raise awareness about TD for patients, family members, and the community. Please see the PDF version of the presentation or resource page for clickable links. Information for this presentation was provided by Neurocrine Biosciences, and more information can be found at talkabouttd.com. What is TD? Tardive Dyskinesia. TD is a DIMD, a drug-induced movement disorder. A DIMD is an involuntary movement disorder characterized by uncontrollable, abnormal, and repetitive movements of the face, torso, and/or other body parts. This can include hand or foot movements, rocking of the torso, lip smacking, grimacing, tongue protrusion, facial movements, or blinking, as well as puckering or pursing of the lips. TD is a chronic condition that is unlikely to improve without treatment. Tardive dyskinesia affects approximately 600,000 people in the United States. Approximately 70% of patients living with TD have not yet been diagnosed. Tardive dyskinesia is caused by the prolonged use of antipsychotic medications. Antipsychotic medications reduce or eliminate symptoms of psychosis, including delusions and hallucinations, by affecting the brain chemical called dopamine. Antipsychotics play a vital role in treating schizophrenia and schizoaffective disorder, but antipsychotics can also be used to treat acute mania, bipolar disorder, and depression. There are two types of antipsychotic medications: first and second generation. Some first-generation antipsychotics are haloperidol, also known as Haldol, and chlorpromazine, also known as Thorazine. Some second-generation antipsychotics are aripiprazole, known as Abilify, and quetiapine, known as Seroquel. Second-generation antipsychotics are newer and also called atypical antipsychotics because they do not work exactly the same as first-generation antipsychotics. They partially block dopamine receptors and affect other things like serotonin as well. First-generation antipsychotics are more likely to cause movement disorders like tardive dyskinesia, although second-generation antipsychotics can cause TD as well. The prolonged use of antipsychotic drugs is thought to result in too much dopamine activity in the brain. This abnormal signaling can lead to uncontrollable body movements like tardive dyskinesia. Although TD is usually caused by the use of antipsychotic medications, other prescription medications, such as those used to treat upset stomach, nausea, and vomiting, may also cause TD. Despite the fact that your prescription medication may cause tardive dyskinesia, do not stop taking your medicine without talking to your healthcare provider. TD movements occur in one or more spots of the body and are often seen in the lips, jaw, tongue, and eyes. They can also affect other parts of the body, including the upper body, arms, hands, legs, and feet. TD movements may contribute to making daily activities like buttoning a shirt, walking, or drinking liquids more difficult or frustrating. TD can look or feel different from day to day. TD movements may be rapid and jerky or slow and writhing, occur in a repetitive, continuous, or random pattern, present as face twitching, involuntary eye movements, darting tongue, piano fingers, clenched jaw, rocking torso, and gripping feet. TD movements may also become worse with stress. The following video gives examples of what TD movements look like. Tardive dyskinesia can impact patients socially, emotionally, and physically by causing worry, frustration, and self-consciousness. Feeling unable to maintain daily tasks due to these uncontrollable body movements might affect more than your physical being. They may also start to affect your mental well-being. Physically, patients can have difficulties with their activities of daily living. Socially, patients often withdraw from social situations or isolate completely. Emotionally, patients feel embarrassed and/or judged. According to a survey of patients with diagnosed or suspected TD, 44% reported that TD moderately or extremely affected their ability to work. 51% reported that TD moderately or extremely affected their ability to sleep. 44% reported that TD moderately or extremely affected their ability to leave the house. Even mild, uncontrollable body movements can affect those with tardive dyskinesia. Tardive dyskinesia symptoms may start a few months or even years after taking antipsychotics. Sometimes symptoms might not develop until after the medication is stopped. In addition to taking a mental health medication, being 55 years or older, being postmenopausal, and substance abuse may also play a role in your risk for TD.
My name is Jeff, and I'm from Philadelphia. I was diagnosed with schizophrenia when I was 17 years old. About a week after my 17th birthday, I had a nervous breakdown. I was hospitalized, and that was the first time I actually took psychiatric medicine. I was diagnosed with Tardive Dyskinesia in 1997. What were the symptoms that I have? A lot of people stare. When children stare at me in the bus, it shows that it's very noticeable. My grimacing. There's times difficult brushing my teeth, putting a belt on in the loops of my pants. Raising awareness for TD is not only important for family members and patients, but also the general public, so they have a better understanding and feel more comfortable when they experience someone with TD. I would suggest that people that think they have TD symptoms to consult with a provider. Despite my schizophrenia and tardive dyskinesia, I'm showing other people that not only can you have a normal life, you can have a wonderful life.
Visit the TD Stories link on the resource page to hear from other people living with tardive dyskinesia. Anyone taking an antipsychotic medication should be monitored for drug-induced movement disorders and/or TD. The American Psychological Association 2020 guidelines for treating schizophrenia recommend screenings every 6 months for high-risk individuals and every 12 months for all others. Screening should include a physical assessment using a tool such as the Abnormal Involuntary Movement Scale, as well as a visual exam of the body. Once TD is diagnosed, you can determine your next steps. Diagnosis and treatments may make a real difference in your tardive dyskinesia. Don't wait to talk to your healthcare provider. If you know someone who may have TD, educate yourself. Know what TD looks like and how to recognize it. Keep an eye out for the symptoms of TD. You may notice uncontrollable body movements that they don't. Encourage them to speak with their healthcare provider. Remember, Caregivers need support too. TD is challenging for everyone involved. Make sure you take care of yourself too. Visit the Treating TD link on this slide for more detailed information about treating tardive dyskinesia. No matter if you have mild, moderate, or severe symptoms of TD, talking to your healthcare provider is the first step in helping your tardive dyskinesia. Your healthcare provider may refer you to a psychiatrist, neurologist, or other healthcare provider with experience in diagnosing and treating TD. If you are looking for a healthcare provider, click the Find a Specialist link to find a provider near you. You can manage your mental health and your TD symptoms. Treatment options include a medication prescription known as a VMAT2 inhibitor. This medication is thought to reduce extra dopamine signaling in the brain. These discussion points will help to guide a conversation about uncontrollable body movements with your healthcare provider at your next in-person, phone, or online appointment. Visit the link and download the patient brochure for more information that can help you prepare for your next appointment. Visit these resource links for more information about diagnosing and treating TD. During TD Awareness Week, look for the TD Awareness Week hashtag on social media for posts from Neurocrine Biosciences and NAMIs across the country as we help raise TD awareness. Thank you for joining us for this presentation on tardive dyskinesia. I hope you have learned some valuable information. Please contact us at NAMI Berks County, PA if you have more questions about tardive dyskinesia or need support, education, or advocacy for yourself or a family member. You can visit our website at namiberks.org, call 610-685-3000, or email outreach@namiberks.org. Also, follow us on Facebook, Instagram, and Twitter.